Thank you. So again, I'm so glad to be here. It's been so long since we've all been together in the room, and it's so good to see so many familiar faces we've known over decades, and it's been such a great partnership with so many of you in our studies, and this is a lot of the work we're doing here and presenting is the work that many of you have contributed to. And I think this room being full also shows us we have a lot of questions. There have been a lot of breakthroughs and exciting things happening in Alzheimer's research in the last 3 years, and so I want to make sure we get time for all your questions. So 3 years worth of questions that we're going to hopefully answer in a half an hour at the end here. So I'm thrilled to have you here. So today I'm going to talk about know your numbers for cardiovascular and brain health. But I want to ask first, how many people in the room before we get started actually know your numbers? How many people know pretty much all these numbers here? Good for you. That's good. That's good. I had to think through before I gave this. I'm like, do I know all my numbers? I should. So again, why I'm going to start with this and end with this is I think a lot of times, when we are waiting for breakthrough therapies for Alzheimer's disease, it feels a little bit helpless. We're just waiting for this disease to come. But I think like Dr. Barzi mentioned, and hopefully you'll see today, that there are things we can do right now to help protect our brains. It's not the only thing, but again, Alzheimer's is complicated, and the more we can do by getting good rest, taking care of ourselves, and addressing some factors that are modifiable, we can change these. It does all make a difference and contribute to our better brain health. So we'll get back to these numbers in a little bit. So I think this is a familiar picture for us that, again, the number of people with Alzheimer's disease is increasing. We're living longer, which is great, but then that means because age is the number one risk factor for Alzheimer's disease, more of us are getting Alzheimer's disease. So this graph shows us that the blue line, which are people who are 85 and older, are really driving, because we're living longer, driving that increase in risk of Alzheimer's, the prevalence of Alzheimer's disease. But as we get older, if we think about other things, those of us who are aging, all of us in this room, as we get older, we also have more common things like high blood pressure and maybe some cholesterol problems and some other health factors. So that accumulation of those things also affects our brain health. Just like Dr. Barzi talked about, sleep and other things kind of having their long-term effect on our brain. So as we get older, we're more likely to have Alzheimer's disease. There are different risks based on our racial and ethnic background, which may in part be due to vascular risk factors, other social determinants of health, and other things that we're realizing affect our health overall. So again, as we think about what are the things that we can do to help protect our brain, a lot of these things are things that happen to us over time that we can make a difference in. So these are some of the risk factors that we're aware of for Alzheimer's disease. So these are things, obviously, we can't do anything about. So aging, as I mentioned, is the number one risk factor. If we have a family history of dementia, so I think a lot of us who are part of the program, either staff, faculty, or participants in our center have family history of Alzheimer's. That's why we're doing this, like myself as well. There's a genetic risk factor, ApoE4 allele, that also increases our risk. But then there's other things too. So these vascular risk factors are all associated with increased risk of getting dementia due to Alzheimer's disease. And these are things we can do something about. So these data are shown that show us that these risk factors accumulate over time. So today, when we talk about know your numbers, we're going to talk about just kind of being comfortable with ones. I think just figuring out what are the things we can do something about, something that's manageable we can focus on. This study, though, led by Dr. Rachel Whitmer, who was a speaker in one of our talks a while ago, pre-COVID, in person. But again, you can see that what they did is they studied the combination of hypertension, diabetes, high cholesterol, and smoking, and they looked to see what is your risk for getting dementia if you add those up over time. And so on the boxes on the left, if you have, 0 is about a baseline risk, so it goes to 1. But you can see as you accumulate these vascular risks, your risk of getting a dementia increases. So it's really 2.5 times or so by the time you get 4 vascular risk factors. So again, this is not insignificant, and so there have been some estimates that quite a bit of our risk for dementia may be from these vascular risk factors, which is something we can do something about. So when we think about the types, then it gets a little confusing, because then if we have dementia from Alzheimer's, is that vascular dementia or is that different? And so these are the common causes of dementia that you'll see listed. So Alzheimer's disease, one called Lewy body disease, where people tend to have, they may have visual hallucinations or tremor, falls. There's other type, vascular dementia, which we'll talk about. Frontotemporal dementia, which tends to come on earlier, tends to have either strong behavioral changes or else strong language changes early on. And then Parkinson's disease dementia, where somebody may have Parkinson's symptoms, motor symptoms slowing down for about 6 to 8 years, and then get some cognitive changes. So you can see here that Alzheimer's, where it says AD alone, is by far the most common type, but we're seeing more and more that there's a combination. Usually Alzheimer's is combined with something else, and a lot of times it's vascular. So they kind of work in parallel to kind of make that progression go faster. So even if somebody has Alzheimer's, if we can get rid of that other contributing factor, it may help our thinking ability stay stronger longer. When we look at the brain of somebody, let's see if I can use I don't think the mouse shows up, no. So on the left-hand side is a front section through our brain as if you're looking straight on somebody's head, and the same on the right. The person on the left does not have Alzheimer's disease, and the person on the right does. So in the top picture, you can see is kind of a schematic of what you're seeing on this MRI scan down here. And you can see that in the person who's healthy compared to the person who has Alzheimer's disease, their tissue is plumper and fuller, and then once you get Alzheimer's disease, there's some shrinkage there. You can also see, which I'll talk about in a little bit, there's like a brownish ribbon on the outside, and that's where a lot of the brain cells are, and the whitish part in the middle is where all these connection tracks are, and so we'll talk a little bit about that as well. So if you look up close at the part where the cells are, that's where you see the neurons or nerve cells in the brain, and they're kind of resting in healthy tissue here. If you look at people who have Alzheimer's disease, you'll see the nerve cells have buildup around them of the amyloid plaque, and that's what Dr. Chin was talking about, these amyloid markers. And then within the nerve cells, you'll see that there's buildup of something called tau forming these tangles. And so those two are the two features that, again, were mentioned as far as part of the biomarkers. So these are the typical changes in Alzheimer's disease. So in vascular dementia, it's a little different picture, though. So in vascular dementia, someone will have some blockages of their blood vessels, and it'll cause a stroke. And they'll have symptoms, and you'll see it on a scan. You can see on the scans, here they have these big whitish areas where the tissue's been damaged from not getting good blood flow. So again, it seems like there's a little bit of discord. You know, the brain scan of the person with Alzheimer's disease looked like it was just kind of gradually shrinking over time, whereas this brain scan looks like there's a pocket that's not getting enough blood flow. But there are common things that contribute to Alzheimer's disease that kind of affect both of these types of dementias. So here's this picture again. This is, again, a shot as if you're looking down from on top of the head, but again, showing those same plaques and tangles in the picture down below. And what this picture shows off to the right then is kind of a close-up of those nerve cells, and then on the outside of the nerve cells, they have a long trail, and then they have this thing called a myelin sheath, which is like a coating. It's kind of, I was like, compare, it's like the coating on electrical wires, kind of. So that coating, again, protects it so you can have the nerve signals go through the connection wires or the neurons so that they can communicate with each other. So if that white coating, I just talked today to a colleague who had a mouse nibble through something. So if you have a mouse nibble through the white coating, and if there's electricians in the room, I'm sorry, I'm not using the right term, whatever, it's got an official name, I'm sure. But the white coating, if that's damaged by blood vessel damage or things over time, then those connection tracks don't work as well. And so our colleague Dr. Benlin does a lot of work on studying those connection tracks in the brain, so those white matter areas, and then the gray matter as well, which is the nerve cells. So in Alzheimer's disease, we also know that there's a buildup of amyloid, and it can affect the blood vessels themselves. And so it can cause some buildup of amyloid in the blood vessels, and it can cause weakening of the blood vessels, and then it makes people at risk for these little microhemorrhages or microbleeds there as well. And so that's important when we talk about these new medicines coming out, these like lecanemab, aducanumab, which I'm sure, or I hope a lot of you have questions on. So what other ways do vascular risk factors contribute to dementia? So there's a lot of different ways. So one is it reduces the blood flow, and I'll show you a picture from our study team in a minute. It weakens the artery walls, like I just mentioned, some of the amyloid buildup. It reduces our brain's ability to kind of clear out the toxins, and so that kind of ties in with what Dr. Barzi was talking about the brain resting, kind of helping to clear out the toxins from our brain. We've talked about how you can have little strokes, that blockages of the blood vessels. And then again, just not being able to clear out not being able to bring good oxygen or clear out that amyloid buildup is probably another way that vascular factors contribute to Alzheimer's risk. So these are data from one of our colleagues, Dr. Leonardo Rivera, who showed in this with some really unique blood flow scans that were developed here at University of Wisconsin. And what this shows is on the bottom left, that shows some three-dimensional pictures of the blood that you can see, the blood flow in the brain. The graph to the right, the black bars are people who already have Alzheimer's disease, and the lighter the colors they are, the less cognitive impairment they have. So again, people who have Alzheimer's, the second gray bar is mild cognitive impairment, and then cognitively healthy older adult, and then cognitively healthy middle-aged adult. And you can see that the blood flow is less in people who have Alzheimer's disease. And then people who have healthier thinking abilities have healthier levels of the blood flow. So again, this is just evidence in a way for us to measure that blood flow in the brain can be measured in people who have Alzheimer's disease, and there's some relationship there between blood flow and Alzheimer's. So what we really care about is, can we treat these blood vessel risk factors, and is it going to help us? It's going to help us to think more clearly. And so there have been some studies that are starting to look, and actually quite a few studies that have been looking at if we treat these blood vessel risk factors, does it make a difference? And so I had a slide before that has a lot of just busy things. The main bottom line is that there is some evidence, especially for high blood pressure. If we control our blood pressure, which a lot of us have, it gets more common the older we get, if we control our blood pressure, it really makes a difference in our risk for getting dementia down the road. There's also good evidence for something called the Mediterranean diet, which has been modified by a scientist from Chicago, Martha Claire Morris, who was a speaker years ago here for our program and unfortunately passed away in the last several years. But she did great work combining it for the MIND diet, so some dietary changes that can make a difference. But we do need some other studies. There's also some studies on statin drugs that are promising. So again, there's a lot of evidence. The best evidence right now is for controlling our blood pressure. And so what's being done is there are a lot of studies that look at what we call drug repurposing, where they try to see, well, this is approved for blood pressure, but can it make a difference in how much amyloid I have in my brain? And so we're doing a lot of those studies at University of Wisconsin. This is, if I had to pick my favorite study of the last 10 years, this is probably my favorite study. So I just made that up, but anyway, but I'm serious. So the Sprint Mind study had people who had average blood pressure pretty unremarkable. I mean, about 130 over, 130 for the top number. And so then what they did is they tried to treat them to see if controlling blood pressure better helped prevent onset of mild cognitive impairment and dementia. And so they titrated different blood pressure medicines. So a thiazide diuretic is one like hydrochlorothiazide, some of you may be on. And then they combined it with an ACE inhibitor, which is a type of medicine like lisinopril or one of those pril medicines, and then a calcium channel blocker. So they gave people a combination, but were really focused on lowering their blood pressure. And they found that new cases of mild cognitive impairment were reduced by about 19% compared to those who didn't have as good a blood pressure control. So some people say, well, it was a combination like the mild cognitive impairment and dementia, but they didn't reduce dementia risk. But this so far and there's been a lot of other data that's promising for controlling blood pressure, reducing risk of developing dementia. So that's my take-home point: control your blood pressure. So I know a lot of people say, wait, I've been on blood pressure medicine for decades, or I've been on a statin for decades, or my parents were on this and they still got dementia. It's true. It's not going to be the only factor in what contributes to us developing an Alzheimer's disease. But if you think about it, for me, if I had 5 more years of good thinking abilities, that would mean a lot to me. So even if it delays the onset by 5 years, it could be a lot of memories there. So if you think about this picture here shows just the accumulating Alzheimer's disease brain changes, so the amyloid plaques and tangles. If you see the black line up top, that's kind of what happens when we age normally. The red lines, if we get mild cognitive impairment and dementia. But if you think about it, if we can shift that over, again, delaying that onset could be really meaningful. I think about this year, I had three of my three sons graduated, big graduations. It was all within a month period. And just thinking back, I'm so glad I have those memories there. And if I was at the risk of getting dementia and had gotten symptoms before versus after, again, all of us have these stories about these really important times in our lives. And sometimes it doesn't line up well. But again, having 5 more years of good thinking abilities can be really meaningful. So what's the future? So a lot of us think, it would be great if we could have a way to diagnose and pinpoint exactly our risk. So let's say we had a person come in. This is my father. So let's say he was a young 78-year-old, came in. His mom had Alzheimer's disease. She got it in her early 70s, and he went to go see his physician, and she looked at his vascular risk profile and said, well, your blood pressure's a little high, your hemoglobin A1C looks okay, LDL's okay, your body mass index is in the obese category, you're sedentary. Let's think about what your Alzheimer's risk is. Maybe he would have a PET scan like the ones Dr. Chin mentioned, maybe a spinal fluid test or some other kind of risk profiling, and then reduce his risk. Let's say you could reduce it then from 50% down to 17% with some of these changes. So we're working toward that. We don't have all the answers yet, but again, it's going to probably be different for each person. How much is blood pressure contributing versus my genetics, et cetera. So we have we have quite a few studies, but I would go to our website. I'm just going to mention 2. Again, we have studies. This one's being done in veterans, is nearing completion, looking at medications that are used to treat high triglycerides in the blood or high cholesterol. Again, looking at brain blood flow. There are other studies being done nationally, internationally, here at our site as well, that look at how can we do multiple things, improve our thinking abilities and do exercise and that combination and improve those factors to see if we can reduce our risk of developing Alzheimer's disease. But if we break it down, again, if we think through, again, like what Dr. Barzi recommended for us to improve our sleep, there are things we can do. And this is one approach about Life's Simple 7, but I'm going to skip forward because 4 is easier than 7, because 4 is less than 7, because I'm good at math. So I'm going to come back to know our numbers. So again, I think if there's a take-home message, especially for the second one, again, the numbers that are shown here are probably going to be a little bit different than for each person because it depends on if you have diabetes or other factors as well. So you should talk with your physician about these factors and what your numbers should be. But again, if everyone got to know what your blood glucose, that first one is, your blood pressure, your blood cholesterol, and then your body mass index, that would be a great first start. So for body mass index, I was going to tease that we all have little tapes underneath because you can also measure your waistline. Everyone get out a tape and measure your waistline, which no one would want to do. But again, these are just health factors. So for us to know these 4 numbers, especially I'm going to say number 2, and really try to work on that as a single goal. In addition, actually, if you sleep better, your blood pressure will come down too, right? And then so everything together. So what else can you do? Join one of our studies. We'll never have answers to any of these questions without research participants. So again, I think there's a lot we can do while we're waiting for the breakthrough therapies, which I'm sure people have questions about, but we can know our numbers and make some progress there. So thank you.